Meet Nikolai. He has been practicing as an RPN for 6 months in an acute geriatric psychiatry unit. Over the last 2 months, Nikolai has filed several incident reports, and as a result was required to attend a mentorship program with a nursing educator to ensure competencies are met before returning to the unit. As part of his clause of returning to work, progressive discipline will be implemented upon any further unusual incident reports. This is Nikolai's first day back on the unit. He is with the clinical nurse educator and is getting reoriented to the ECT procedures. Since he has returned, there has been a change in management as well.
The following week, he is assigned as Miss Brown's primary nurse. Miss Brown is an elderly patient diagnosed with depression as well as early onset dementia. The night before Miss Brown's first ECT appointment, she requests a sandwich for her hunger. Not considering Miss Brown's NPO status, Nikolai feeds her the nighttime nourishment. When the nurse returns for his following night shift, his manager informs him that his patient had a bowel movement during ECT. But Nikolai denied any wrongdoing when questioned about feeding the patient the night before. Nikolai has excelled with his role over the next couple of months, and today is assigned to take Miss Brown down for a scheduled ECT appointment in the morning. As the nurse escorts Miss Brown to the surgical admission waiting room, he remembers that he left the patient's chart up on the unit. He decides that running up to the unit by himself would be quicker than bringing the patient along on the wheelchair. After grabbing the chart from the unit, the nurse returns only to find Miss Brown missing from her wheelchair. After searching the floor, Nikolai decides to contact security, upon which a code yellow is announced. Security was able to locate Miss Brown unharmed, who eventually received her scheduled ECT treatment. 1 week later, Nikolai is again preparing Miss Brown for another ECT appointment in the morning. Due to a heavy patient load, however, that morning, Nikolai finds himself rushing during medication administration and accidentally administers Miss Brown's standing order medications along with her pre-ECT medications. This action ultimately leads Nikolai to a 1-week suspension. Upon returning to work a week later, the nurse manager advised Nikolai to attend in-services regarding ECT and the nurse's role, which he does attend. A few weeks later, however, Nikolai makes the mistake of not preparing Miss Brown for ECT before the porters are there to pick her up. The porter, a good friend of the nurse manager, complains to her, who is by this time fed up with all the complaints about Nikolai and decides to terminate him from his position.
You're fired.